Tom McNulty, and you're listening to Secure Ventures, the show that follows cutting-edge founders in the cybersecurity space to understand their plights, glories, and revolutionary products. With me today is Chrissa McFarlane. Chrissa is the CEO and founder of Patientory, which is revolutionizing the healthcare space by giving consumers control of their own medical data. Chrissa, thank you for coming on the show.
Thank you for having me, Kyle.
Now, of all the interesting undergraduate degrees we've had on the show so far, I think you take the cake. You double majored in Africana Studies and Spanish, and you also double minored in Latin American Studies and Global Health.
I know.
Did you?
Quite the liberal arts specialties for sure.
Did you love school?
It was awesome.
All right. And so after school or after undergrad, it looks like you went to get your pre-med certificate. Did you know that you wanted to do that all along?
I definitely wanted a well-rounded education.
Yep, and it sounds like that's what you got as well. So when you were on your pre-med track, what was it that you were originally hoping to do? Did you want to become a doctor at that point?
Yeah. My dream, childhood dream, was to be a practicing surgeon.
Oh, wow. Any type of surgery in particular?
No, I mean, it was more, I would say something invasive. Heart surgeon was one of my top interests.
Right.
I know I wanted to do something with, fixing the internal organs of the body.
Okay. Yeah, very neat. And so I take it then after pre-med school, you went ahead and got a job as a lab researcher, kind of continuing along that path, but then you ended up actually starting a restaurant about a year into that research position. What really happened there?
Yeah, no, actually, I started out doing research in high school as part of, it was an elective in high school. So I did research under a professor at the Albert Einstein College of Medicine in the biomedical lab. We worked on Legionnaire's disease and the bacteria Legionella, which I won honors in the New York City science and engineering competition that they have. A lot of the entrants go on to the Siemens, which is a big, I would say, high school science competition. And then I continued my research throughout my undergrad career. So I ended up doing continued biomedical research for the USDA there. During that time, my family started a restaurant that I assisted on the operation side of that in New York City.
Okay, so that was a family restaurant that was kicked off there. Who was really the driving force behind that in your family?
My dad. So they started a couple of restaurants prior when they moved to this country.
Interesting. And so going through that experience, building out the restaurant and really being involved, it sounds like directly for the first time, did that kind of change your perspective as far as what it was like to be an entrepreneur? Did that give you the itch?
I think it did. It was part of it, just seeing, build something from nothing. My goal was always to, be a practicing doctor and at least be on the administrative side of healthcare. Getting that well-rounded education, learning about cultures, about people, is where I thought would essentially help me in being a better healthcare practitioner.
Right. And so you worked at that restaurant for about 2 years, and then you ended up switching research positions kind of midway through. So you were balancing the restaurant with your other research position, and you moved over to the Department of Agriculture, and you were there for about a year. Then the restaurant kind of faded away. What's the whole story as far as what happened?
Yeah, my parents shut it down. It was at the 2008 recession, so they decided that they were going to early retire and go to Atlanta. So they actually moved out of New York my mid college career. So they actually went down to Atlanta.
Well, I guess early retirement sounds like not a bad scenario as far as the 2008 recession.
Yeah, right.
And so after the agriculture research, you then shifted more towards community-focused work.
Yep.
Worked in mental health outreach, and then as an elementary school teacher as well through AmeriCorps. Did something in particular trigger that shift?
Not really. I felt more being in the lab. It was like it didn't really interact much with people. So, the PI I worked for, she defended her PhD and she actually moved out to California. So I had a chance of staying with the lab, but a position opened up at the Cayuga Medical Center where I'd be more involved in building community programs, which as you saw through the Mental Health Association. So I actually built that program from scratch alongside the executive director, which even gave me more insights into being an entrepreneur in the healthcare space. So that program is still in existence today. It serves over 500 adolescent youth in Ithaca with mental health services through the Cayuga Medical Health System. So that really got me, just to see the impact that had in the community and changing the lives, especially, we work primarily with adolescent youth. And just seeing just what a resource like that can have an impact in overall health quality, right? But essentially, as these children grow up, so that they're like really made me passionate even more about, instead of, not only practicing medicine, but just seeing the impact that just these resources and services can have in preventing a lot of the illnesses that we see come into the emergency room today.
Right. That's an incredible impact that you did have in the community there. And it sounds like you said, it's really that first combination of building something from the ground up that's specifically targeted at the healthcare space. And we'll obviously touch on Patientory in a couple of minutes here. So after that community outreach effort, you then worked as a teacher through AmeriCorps.
That was my my gap year. I joined AmeriCorps. It helped me get acclimated to the Atlanta ecosystem. So while I was applying for medical school, I joined the service corps. I worked with the Alonzo A. Crim Center, which is essentially the educational center at Georgia State University, and worked with principals throughout the Atlanta metro area, and that worked with elementary school populations on adding science and math curricula to their teaching programs, which a lot of these schools are underserved. They didn't have budgets to, help provide a lot of the science and math electives to these students. So part of that was, creating these programs, and I went in to one particular school and taught science, math, and arts to that school for a year as part of my service corps opportunity.
How did that experience as a teacher and an educator really influence you thinking back on the last handful of years in your career?
Yeah, I mean, it's definitely a way for me to give back. I remember, growing up in New York City as well, I had the opportunity to do a lot of, like I mentioned before, a lot of these science opportunities, which was not available, in every school. I went to a specialized science high school. So being able to go into these underserved, underfunded communities and give back what I essentially, learned. And also, again, seeing the impact and just, opening up these students' awareness of what was out there in the science and the STEM world or the STEAM world, really help also in, bridging that gap between, again, when you look at it in healthcare, a lot of chronic diseases that we see today are preventable just through education. So that really helped in actually making me even want to, go further into the healthcare industry.
Right. And so after that experience, you then did a brief stint as an independent consultant. What was that like for you? Why'd you opt to go the independent consulting route as opposed to?
Yeah.
I'm sure
So,
some
while applying to med school, that was actually through while I was in business school. So
other-
it's pretty surprising, going to business school straight out of undergrad, pretty young. Like, the average age, and I went to Wake Forest, was about, 29 or 30. And here I was just like 22-year-old, right? What did I know about business? But I think my experiences at such a young age as a teenager, being in, working in my family business, doing all these cool things in building programs in healthcare really helped me to frame, my experience in business school that, part of our capstone project was consulting. So I consulted for a pharma company, mid-tier pharmaceutical company, ended up then consulting for an electronic medical records integration company. And I loved it. I loved the business process. I love, as a consultant, like solving problems, going in. It was like you're essentially a doctor for these businesses. So that really changed my mind and really, took a career trajectory in, where I thought I was headed and where I was headed. Um, so that was like one of the, I would say, pivotal moments that would lead to the emergence or the start of Patientory.
Mm. Yes, I haven't heard that analogy before. Consultant being a doctor for business, but I'm definitely gonna have to use that one at some point.
Yeah.
So then you did that for a couple years, and then you had a product management opportunity that arose. What was that like?
Yeah, that came out of the blue. I was contacted by essentially one of the co-founders of this telemedicine company, and during that time, telemedicine was still emerging tech. It was still pretty new technology. They were pretty successful. They had raised over $6 million in a Series A by, big names in the venture capital and on tech industry. I had never worked for a tech startup before, but I agreed on the position. It was the co-founder was actually an alumna of Cornell. So that's how she found me. And I decided to head back to New York. And being in that, healthcare tech, it was still pretty, new niche. And I fell in love. I loved it. I was like, this is exactly what, I want to do. I was able to use all my skill sets and problem solving, be in healthcare at the same time, but, work on solving some of healthcare's, hardest problems with solutions, technology solutions.
Right. And so sounds like when you decided you really wanted to do healthcare tech, and then Patientory wasn't far behind. So what did that look like? What ended up inspiring you to actually start your own company in Patientory?
Yeah, that experience really opened me up to just the challenges of acquiring healthcare information. So part of it was I was in charge of the insurance product, really meeting the needs of patients or consumers that, logged onto the app, needed help with their insurance reconciliation or connecting with our doctors via the app. And one of the biggest problem we had every day was, how are we getting their medical records, right? Mm-hmm. And from that experience, just seeing, doing more research, seeing interoperability as, healthcare's biggest challenge for the past, I would say, 15 years or more, I continue to just gain more awareness on the problem, and just how it needed to be solved in order for like telemedicine, a lot of these new emerging solutions in healthcare to really thrive and take precedence.
Now, I think the healthcare system, at least in my impression, is fairly hard to disrupt just because of how integrated some of these different ideas are. Did you receive a lot of pushback when you first started with this idea of really giving data control to the consumers?
Oh, of course. Not to mention, I talked about blockchain, and when I started, no one knew what that was. It was like 2015.
Right.
And people were they're with glossy eyes, just glanced over what I was saying. So there was pushback there from just, okay, what is this technology? It's not like a high priority. And then the part about ownership of data, it was just more like, okay, well, how are you going to get the electronic medical records to sign on to this, So there's definitely a lot of pushback there for sure.
So walk me through the product. This obviously isn't a kind of traditional security company like some of the other founders I've interviewed, but security is such an integral piece of the platform because of the healthcare data that's being stored. What's really the kind of key functionality use case for the app?
For the security? The security is really the assurance that we want to give both our consumers and enterprises that use the platform, that you're now acquiring all this information, it's secure through a decentralized and distributed system with encryption, modalities that ensures that, once you have this information, no one else, has the ability to steal that or gain access to that information, which is one of the big issues in healthcare today. We see 1 in 5 or 2 in 5 hospitals are at risk for ransomware attacks. And healthcare data on the black market is pretty lucrative, right? So by building out this secure, infrastructure, then we can talk about, the privacy and the ownership of that information residing with the individual.
And in your words, for the listeners who aren't familiar with Patientory, what is the app really designed to accomplish? What are kind of the key features within it?
Yeah, our Patientory app is focused on essentially giving ownership of healthcare information. So that's medical records, wearable device, medical device data in the hands of the patient. We use blockchain technology as that underlying infrastructure to aggregate the data, but also create a unique identification identifier, on the system that belongs to that individual. So this is their entire longitudinal health history, regardless of what physician they go to or health system they go to.
And is part of the platform designed to capture historical data as well? Or is it really just future data after the user downloads the app? Is there any way to recover all those old doctor's notes from 5 to 10 years ago?
Well, yeah, if your medical data is in an electronic medical record, our goal is for you to have as far back as possible access to that information and ownership of that information. And then our subscription service, we then use that information to recommend, what you should be doing to improve your health. The core goal of our app is, when we started the company, it was this lack of data access, and we were at the heart of an epidemic of chronic diseases in the country. So by putting access to the data, we're able to really focus on how we can use this information to make you healthier.
And going back to your subscription model, you did decide to use a storage-based payment model, which is rather interesting for an application of this type. What triggered that decision?
Because it's the network. So we liken it to like you storing files on your Apple Cloud or Google server. You're basically acquiring all of your health information. Someone has to pay for it. So while our subscription is really focused on getting you healthy, with storage built into that, fee model. We're essentially building out a decentralized, I would say internet of medical information that's secure. So, part of that cost is also absorbed by our enterprise users. But for the individual, we definitely want to keep track of how much information they're storing. Whether or not, it's free because you have insurance or you opt in to pay the subscription cost, where we're able to manage on the back end of the servers in the system to keep that information secure.
Okay, and so you've talked about decentralized approach of Patientory and blockchain a couple times now. I do want to go a little bit deeper into that, but first, could you go ahead and provide maybe just a quick 30-second explanation of blockchain for some of the less technical listeners?
Yeah, no, it's for, not to get too deep and technical, but blockchain, as we know, is the underlying technology that gave rise to Bitcoin, allows us to have digital currency and, pass back and forth with digital currency. Blockchain in healthcare and what Patientory has used it, it's a upgraded database, but it allows for the management, big data management of health information and the identification of that health information to be owned and shared. So again, transferred between parties.
Yeah, that's a fantastic quick explanation. So thank you for that. You actually were a writer with Forbes, I think still are, and contributed to both healthcare and blockchain related pieces. And blockchain has obviously been a key portion of Patientory from the get-go. Where did this interest in blockchain and cryptocurrency really come from?
More or less in the problem I was solving. I set out to solve this big problem in healthcare. And, I was in the right place at the right time. I saw blockchain and the technology as, a means to make that happen. And in, putting on my researcher hat and doing that research, being one of the really early researchers in the space, our company issued the first healthcare cryptocurrency back in 2017. Part of my initiatives to be a thought leader, but also, bring clarity to the space. I started writing for Forbes.
Yeah, so I would like to dive a little bit deeper. You mentioned Patientory's cryptocurrency and the decision to go through that route. I think I saw your subscriptions in short time here are actually going to start being paid in your own cryptocurrency. What was the decision to take that approach for your own payments as well as just the communication of data?
Yeah, well, the subscription, the token really regulates, again, it regulates a lot of the smart contracts and also the amount of data on the system at any time, right? So it is a fungible, but also utility in where it manages storage for the network. But in our use case, we incentivize users with tokens for positive, healthy behaviors. So that's the use case that we use the token for in our system.
Interesting. So it's almost like a little bit of gamification within the application.
Yeah.
So looking back on the last 6 or so years now since you've been at Patientory, what have really been the defining moments where you or the team has overcome a challenge that really propelled the company forward?
A defining moment, I would say, it has to be last year when they finally passed the Cures Act and the data block-in. That was huge. There's been a lot of companies prior to us that has tried to solve this problem, but I think, again, being in the right place at the right time is really important. And we were pretty excited when that happened and to see that finally come through. I sit on the HIMSS Interoperability Committee. So we, had a lot of discussions and, inputted a lot of, feedback while they were working on that. out. So that was really exciting.
And so for those who aren't familiar here, including myself on this one, do you mind expanding on that clause in the CARES Act?
Yeah, so the 21st Century Cures Act is essentially a law that was passed at the end of Q1 last year, end of March 2020. It basically now ensures that health systems, electronic medical records company, cannot block access to health information, and they have to require, through standards or something, third-party access APIs to obtain health records on behalf of the individual.
Interesting. And so that's made basically data collection for new users for your platform much easier, so they can go ahead and collect that information.
Exactly.
Yeah, that's fascinating. So thinking back on that big win and just the momentum that Patientory has right now with all the focus on healthcare, what's really next for you and your team?
We're really focused on adoption. We've been right now recruiting for clinical trials. So, we're really looking to improve on that, and really start to acquire the community to take charge of their healthcare and be involved and actually be incentivized for it.
And what's the approach to going through that whole process?
As a user?
As a company looking to grow your overall just user base in such a, I guess, novel way for a very traditional healthcare process, very disruptive.
Oh yeah, it's definitely innovative. I see, because our focus is so, heavily relied on the individual, bringing the patient back into the healthcare equation. We sort of have like a consumer aspect to it. So it's definitely a lot of, groundwork, and again, you're going education, right? And providing that information and awareness there.
Right. Okay, well, best of luck to you and the Patientory team moving forward. It sounds like there are some exciting challenges ahead. Last question for you here for the listeners. Are you currently looking for investment or hiring?
We are. We're currently actually in our go-to-market strategy. It's great you asked that question. We are raising our pre-seed round. We're hoping to close that soon. That would essentially, speed up the momentum in our go-to-market strategy, start building out the team and really being one of the first early companies and really get an ownership of health data back into the hands of the individual.
Fantastic. Well, thank you again for your time today, Chrissa.
Thank you again for having me. It was a pleasure, Kyle. Thank you.
Thanks so much for listening to this episode. You can subscribe wherever you get your podcasts, and you can write to me at kyle@secureventures.io. I'm Kyle McNulty, and you've been listening to Secure Ventures.